Hello, everyone, and welcome. I'm Sushmita Chaudhary, President-elect of the ASM Foundation Board of Directors. I would like to welcome you to the Sleep Grand Rounds, co-hosted by the American Academy of Sleep Medicine Foundation. Today, Dr. Grace Vincent will join us to discuss sleep health challenges and risks among young shift workers and the development of practical evidence-based resources through a participatory co-design process with industry partners. I would like to remind you that your audio is muted and your video is off. We encourage you to include any questions on this topic or for the speaker in the Q&A of the Zoom platform. This webinar is being recorded and will be shared with everyone who registered for the webinar. Additionally, closed caption and live transcription of the webinar are available. This webinar is approved for 0.75 AMA credits. The Sleep Grand Round aims to feature ASM Foundation funded work that addresses practice gaps in sleep medicine and sleep health. The Foundation funded work is related to improving patient care and sleep health awareness. Learners should attend the seminar series to understand the practice and sleep health gaps and how the Foundation funded work is addressing these gaps through this project fundings. The objectives of the presentation will be to disseminate knowledge, potential change practitioner behavior, and improve patient outcomes. Now allow me to introduce our speaker today. Associate Professor Grace Vincent is a sleep and shift work researcher at CQ University's Appleton Institute of Australia. Her research focuses on helping workers sleep better and stay healthier by developing practical evidence-based solutions for safer workplaces and 24/7 operations. Since completing her PhD in 2016, she has published more than 130 peer-reviewed papers, secured over $4 million in competitive research funding, and received more than 25 research awards. Her work spans workplace sleep health, physical activity and nutrition, and behavioral interventions to support better sleep. Grace also leads a growing research team committed to scientific integrity, mentorship, collaboration, and real-world impact. Thank you for joining us, Dr. Vincent. The floor is yours.
Thank you very much for that introduction. I'm going to share my slides now, so just bear with me for one moment. Okay, so I'm going to talk to you today about a really exciting project that was called Healthy from the Start. And in this project, we co-designed sleep health resources for shift workers, as well as physical activity and nutrition as well. So firstly, I'd just like to start by thanking our funders. So the American Academy of Sleep Medicine Foundation was the main funder for this project. And yeah, I'm really excited to share the findings with you today. And these types of projects wouldn't be possible without the funding from the foundation. So very grateful. This was a large project team, so I won't go through everyone on the team, but a large group of experts from all over the world contributed to this project. And there were a series of other smaller funders as well. Continuing with just a few of the things I have to say before we get into the nitty-gritty. I have no conflicts of interest, and I've got the accreditation statement there as well. So your learning objectives for today. So on completion of this presentation, I'm hoping that you have a really great understanding of why young shift workers may be at higher risk for poor sleep and other health challenges. I'll describe the co-design process and what that actually means and how we went about actually working with shift workers and other industry-based representatives to create really practical health resources that they could use, and identify key principles for supporting young shift workers with realistic, positive, and accessible advice. So how did this project start? Well, in 2023, we published this paper in Sleep. These were the first healthy sleep practice guidelines for shift workers. So we have healthy sleep practice guidelines for the general population, but those that were really focused on shift workers were missing from the literature. And so we got together 50 scientific experts from across the world and ran a Delphi study. So a study where we worked on various rounds back and forth with experts on determining what the sleep guidelines should be. So the result was an introductory statement followed by 18 key recommendations that we had as well. So I'm not going to run through all of the guidelines, but you can access the full guidelines at that QR code there. And so while developing these guidelines was a really important first step for us, we wanted to go further. And we know that guidelines in themselves don't necessarily result in changes to behaviour, and that shift workers need practical, accessible resources that they can apply in their daily lives. So that was the next step for us. So we wanted to focus on young shift workers. And you might ask, why young shift workers? What's so important about this group? So these are people earlier in their career. They're at a really high risk of poor sleep and poor mental health in particular. And they represent a large proportion of the shift work industry here in Australia and abroad as well. So we really wanted to focus on this group. This is a time, when you're 18 to 25 years old, you've got newfound independence, you've, moved out of home, you're engaging in more risky behaviors and have fewer healthier habits. And you also feel, resilient and a bit untouchable. So we really wanted to focus on this group. And we know that habits formed in those early years can really stick for an entire career. And so that early intervention is really important in public health and in workplace health. So these were some of the things we were hearing from workers. So I've spent 15 years working in shift work research, and these are some of the really common things that shift workers would say to us. So the first one there, we talk a lot about sleep. And information is much more readily available now, but it isn't accurate or it doesn't really apply to me. So there's lots of information out there, but the information that's really applicable to this group was really missing. So there's, for example, information about sleep regularity, amazing research in that space in the last 10 years or so. For a shift worker, getting regular sleep and going to bed and waking up at the same time is basically impossible if you're on a rotating schedule. So there's all this, evidence out there, but shift workers are looking at it and thinking, okay, so how does this relate to me? Or how does this apply to me because I'm a shift worker and my situation is different? The middle quote there needs to be an education piece before you go into it. Most of us are just learning from our mates. So that means friend in Australia. And it's not always the right information. So a lot of people just learning from people around them, a lot of people having quite large caffeinated energy drinks on shift, and people not learning what evidence-based information is. What does the science say about how to manage your health as a shift worker? And finally, when I started shift work, I wasn't told anything. There was no education. There were no pointers. So there's just this attitude of working around the clock and a real lack of respect for your health. So these were really common messages we were hearing from our shift work populations across a range of different industries. So the emergency services, healthcare, and any type of shift work organisation really. And we really wanted these resources to be applicable across industry rather than be tailored to a specific group. So the aims of this project were to co-design resources for young shift workers. So that meant working with young shift workers to create these resources. What do they want? How do they want it delivered? And so that was a real central part of this project. We wanted to address 3 health behaviours, so sleep, nutrition, and physical activity, very important for shift workers, and provide evidence-based, tailored, and freely available information. So by tailored, I mean tailored to shift workers, and evidence-based, so based on the science. So as I mentioned, lots of information out there. You can jump on Google and and look at, various information related to sleep and shift work, but what is evidence-based? What's actually really grounded in the science? And that's what we wanted to create. It was also really important to us that these resources were freely available. A lot of people in shift work industries, um, don't have access to health information that can be really beneficial to them. And so it was important for us that all the information and all the outcomes of this project were freely available to shift workers. So I'm going to chat now a little bit about our co-design process. So in this project, we had a range of different what we call co-designers. So firstly, our young shift workers, they were our target group. So they were the most represented in this co-designer group. So they're the group that we're really focused on because that's the outcome. We also had science communication specialists, and I loved having this group within our co-designers because they provided something really unique. So as scientists, we can get, really bogged down in the jargon and the nuances of the science. And these science communication specialists found a really great way of being able to provide, I guess, a bridge between the shift workers and the academic experts. So being able to communicate our scientific ideas in a really engaging way. So they were really important to this project. We then had work health and safety experts. So these were people that actually work in the industry, and they, might be the workplace safety, representative, and they're dealing with incidents and managing injury risks and all of those things. So they're the really on the ground people embedded in shift work industries. So that was really great to hear their perspective as well. Obviously, the academic experts, a large team of us, contributed to this project and were involved in the co-design process and really ensuring that the content was evidence-based, and we're drawing various other experts for certain sections as well. We then wanted to have some previous shift workers in there. Why did people leave shift work? Was it because they, didn't know about some of the health impacts of shift work, or they found that out and decided to leave? So really trying to understand their perspective on what it meant to be a shift worker and what might have caused them to leave shift work in the first place. And finally, experienced shift workers, because we just wanted to have a few of these people in there to kind of look at the trajectory of their shift working career. And for a lot of young shift workers, I guess you don't know what you don't know. So they're going into shift work for the first time, and these more experienced shift workers have a bit more of a focus on what it's been like over the course of their career. So all of these people contributed to our co-design process, and together they ensured that the resulting resources were really grounded in the evidence and built for these young shift workers, built with them and not just for them. So what was the methodology? So we recruited participants, and then basically the short story is we ran a series of different workshops and various rounds of feedback where we got participants to really tell us what they needed and wanted to know about health and shift work, particularly sleep, nutrition, and physical activity. And then we had a series of rounds where we would present back content to them and discuss ways on which that could be presented back to them. So we used a qualitative analysis using Braun and Clark's reflexive thematic analysis, and it was a hybrid inductive-deductive approach. So the data was led by shift workers' voices, but really framed in that evidence. So what was the result? What did the shift workers really want out of this process? So in terms of the resources, we created a website. So this is healthyshiftwork.com.au or healthyshiftwork.com. We have both of those URLs. Was kind of surprised that we were able to get Healthy Shift Work. So it was fantastic that we now have the website in that space. So in the website, there's this landing page here where you click on whether you're a shift worker or you're an employer or workplace, and then you go to various resources within the website. So you can reach the website at that QR code. And as I said, it's www.healthyshiftwork.com.au or .com. Given young shift workers, it's probably not a surprise that they really wanted to have a strong social media presence as well and been able to get these resources out through social media. So we have an Instagram page as well where we share resources and content on there too, as well as a Facebook page. So the grounding resource is this website. It's got a lot of different content on there, and then we have a series of infographics. So these are a couple of examples of some of the infographics that were produced from this project. So the one on the left there is about sleep and good sleep and not so good sleep. And then the one on the right there is around caffeine and how to manage caffeine around shift work. So we've got a range of different infographics, and these have been used in organizations to be put up in workplaces, on, in break rooms, and for shift workers to really have that evidence-based material that's communicated in a very simple way. And you can imagine as scientists, there's a lot of heavy debate around, making sure the nuances of the science are really brought forward in these infographics, while also balancing the ability to be able to make the content really clear and accessible. And we were targeting young shift workers, so that is why we have sort of this really infographic-y, cartoony style to these infographics. I wanted to sneak this one in here as well, because this is one that we just finished developing with a government health organisation over the past week, and this is around healthy eating basics for shift workers, and how to build a balanced meal, and really provides some really practical advice for shift workers. A real other foundation piece of this project was the development of a large animation that then is broken up into various different parts. And I'm going to play you a snippet of that now. So this one is about sleep, but we have other shorter videos around nutrition and physical activity as well as a new video dedicated specifically to healthcare workers. So I'll share this one with you now.
This is Ashley. She recently landed her dream job as a firefighter. She loves the work, but those shift changes have hit her sleep schedule hard. Shifting between early starts and late nights means that even on her days off, she's having a hard time sleeping properly. This is a common problem for shift workers. Being asleep or awake at irregular times can lead to body clock disruption, which makes it difficult to rest properly. Because she isn't getting enough sleep, Ashley may be more susceptible to health issues in both the long and short term. For Ashley, trying to get 7 to 9 hours of sleep per 24 hours is an important first step. I suggested that Ashley visit healthyshiftwork.com.au to learn more about science-backed strategies to improve her sleep as a shift worker. Now she's taking the right steps to adjust her sleeping patterns.
Fantastic. So we talk about these different characters. We've got Ashley, who's the firefighter, and then we have Dylan, who works in our mining industry here in Australia, and then we have Timur, who works as a hotel receptionist. So we go through these different friends and talk about various strategies and direct people to further information. So just wanted to focus a little bit now on the sleep-based aspects of this project and what the shift workers really wanted out of this. So what was really interesting is that I think often as a shift work researcher, you want people to be aware of the short and the long-term impacts of inadequate sleep, but you don't want to scare people as well around what some of those impacts are, which can be quite big in a lot of ways in terms of their long-term health. But people want to know about it. So they want to know, what are the impacts of this type of work and what I've signed up for. And yes, I might love this job, and I might, potentially get paid a little bit more on night shift or those kinds of things. But what impact does that actually have on my health? So that came out really strongly. Another key one was the prioritization of sleep. People just battling on, and it catching up with them as well was a key thing that kept coming through. And then also just this real lack of information. What is sleep? How does it work? What are the stages of sleep? Kind of, I guess, sleep 101. Like, what are the basics of sleep health? People wanted to know about that as well. So, as well as timing and when when to sleep on different shifts, etc. So, in terms of sleep, these were the main themes that came out of this project. So, yeah, those real essentials of sleep science. So, what are the basics of sleep? Understanding, what sleep disorders are, what a circadian rhythm is, what your body clock is, those sorts of things, and then the impacts of poor sleep, in both the short and long term. And then, of course, I guess those classic sleep hygiene tips or healthy sleep practices that impact people. So, caffeine, alcohol, sleeping medications, and then strategies and actions to really deal with that. In particular, napping, when to nap, if people are allowed to nap on shift, even between shifts, and all of those sorts of questions as well. We weren't focusing on workplaces for this project, so it was really focused at the individual shift worker and things they could do. However, we know from research and a lot of the stuff we do in industry that a shift worker could do everything right in terms of managing their health and their sleep. But if their workplace and the system that they work in is not set up in a way that supports them, then they're always going to be set up for failure. So we do have a small section on workplaces and what workplaces can do to support their workers with their sleep, nutrition, and physical activity. So what we did is, we're hearing these discussions from shift workers. We have these 5 themes, and then we did a mapping exercise, and this is just an example here, where we have the various codes from the young shift workers, so things that they brought up regularly. They're developed into a theme. So here we've got sleep science basics, and then we map them onto those guidelines that I talked about at the start of the presentation, which was our 2023 healthy sleep practice guidelines for shift workers. And then we supplemented that with the evidence base around those topics, and then created the resources. So the website, the infographics, the animated video, and the social media. So that provides a bit of an overview of our process. I now want to share with you a perspective from one of our co-designers. So this was a young shift worker who was part of the project and kindly shared her perspectives on the project with us, and was really great to get her perspective. So wanted to share this with you. This is Chloe. She's an emergency department nurse in Sydney.
Hello, my name's Chloe and I work in a busy Sydney emergency department. I participated in the Healthy Shift Work project because I know firsthand the challenges of working shift work and trying to maintain a healthy and balanced lifestyle. I feel like this is an area that's under-supported, and all the resources and information are targeted to people who work 9-to-5 jobs and can access a healthier lifestyle easier. I felt like too, if I participated in the research and the project, that I would gain information along the way for myself to be able to promote a healthier lifestyle while doing shift work. I feel like the researchers did the project really well. We were included along every step of the way, and I felt like the opinions and knowledge that I gave them was really taken on board, and they worked alongside us to really get a good understanding of the challenges we face when working shift work and trying to maintain a healthy and balanced lifestyle. To then see all that information that we gave be put into information for other shift workers was really rewarding. It was all put into information that was easy to digest, it was visually captivating, it was accurate representation of what's experienced and gave really good research-based, simple and I guess engaging information that can then be used to improve our health and wellness while also working shift work. I felt like it was really well done, and seeing it all at the end was really rewarding. I really appreciated having the opportunity to participate, and it was definitely worth it. Thank you.
Awesome. So great to hear Chloe's perspective on the project. And we also evaluated our co-design process using the public and patient evaluation tool. And as you can see here, across all of the resources, so the website, website infographic and animation, really high scores in terms of how people felt like they were valued and heard during this process. So we were, really happy about that. So what are our main learnings from this project? So the first one is really tailoring to shift workers. So not providing that generalized advice that the general population get, but really tailoring to shift workers themselves. They have a different set of parameters. And so it was really important that we tailored to that. They wanted to know about the risks. They wanted to know about what was not good about shift work, but they also wanted the resources to lead with the positives. What are the benefits of having a great sleep? How could that make me better at my job and better at life? So really leading with the positives while also acknowledging the long-term health impacts. Designing with them, not just for them, it builds trust and relevance. And it means that when we're going back to our industry partners and working with other shift work organisations, we have a really strong understanding of what people actually want and how they want it. We talked about the shared responsibility model, so that is that workplaces have an equal role in this as well. So it's not just up to shift workers to be responsible for their own health and well-being, but it's also about the workplace to provide a system of work that really supports them and their recovery. And particularly for this group, it was about going digital, using really engaging resources that were up with the now. So really tech-based. We're currently working on an agent to be able to take the content we've provided and be able to provide shift workers advice as if it was like a sleep health coach for shift workers. So that's one of the next steps of the project. But really bringing the science to the now in terms of the delivery of this information. So where to from here? So some of the shift workers wanted to continue being involved in the science and this project. So we developed so from the Appleton Institute, so we developed a shift work consumer engagement group where we meet with them regularly and talk about our science and some ideas that we're having and ideas they're having, and really beneficial to have those voices as part of our research now. We're tailoring these resources further to certain sectors. So we just finished a project with Queensland Health, which supports all healthcare workers in the state of Queensland. And so they wanted some further tailoring specific to healthcare workers. So I mentioned we have edited the video to be based on healthcare specifically, and so now have a healthcare version of the animation, as well as some additional infographics. In Australia, we have people that do a lot of shift work in our regional areas, so areas where they might have to drive really long distances to and from work and live really remotely and have limited access to healthcare in those regions. And so we have a real focus on extending the project into those areas. And we're also wanting to translate the animation into different languages as well to improve that accessibility to different groups. I talked a little bit about workplaces, and that was something that we know was a missing piece of this project, I guess. And so we're actively working with workplaces to improve, I guess, their management of sleep and fatigue within the organisation, as well as things like looking at their rosters, providing training for their organisation, as well as the resources and research partnerships as well. So as part of the employer or workplace tab of the website, it's really focused around how we can support workplaces to provide a better system of work for shift workers. So I think I will wrap it up there. Just wanted to give a big thanks to the team. It was a really large team that worked on this project. All the people in this photo here, plus some collaborators from overseas and a range of different students worked on the project as well at various stages. And again, a massive thanks to the AASM Foundation for funding this project. These types of projects, the real translation end of the scientific spectrum is particularly difficult to get funding for. And so we're just super grateful for the foundation for supporting this project. It was an amazing process, seamless in all the communications, and yeah, we're just really grateful and really happy with the outcome. So thank you very much, and yeah, happy to take any questions. Cheers.
Thank you so much, Dr. Vincent. That was excellent presentation. Very interesting topic. I did learn a lot. So as I mentioned earlier, folks, if you have questions, please type in the Q&A of your Zoom platform, and I'll be happy to present it to Dr. Vincent. And while people are thinking of asking questions, I have a question. So I know that you spend a lot of effort doing this. So I was wondering if you can share what kind of feedback did you get from the senior researchers or the senior shift workers that you had included in your group?
I think the main piece of feedback was, I wish we'd had this when I started, or I wish I had this information. And I think including them was really valuable because, they have gone through, some of them, one of our most experienced shift workers had been doing shift work for 40 years. And so I think over that time, you you yourself figure out what you try lots of things. There's a bit of trial and error with, okay, I know after a night shift I have a big sleep, and then I might wake up at this time and then have another sleep before I go on to my next night shift. So you work out things for yourself and what works for you. But I think having a real basis of, yeah, okay, this is the science, this is what the science is saying, rather than what my friends are saying, or what I think's working for me, but might not be, or this is something I could try, was really beneficial. So I think, yeah, the main feedback was just, yeah, I wish I'd had this, or I wish I'd had this information. But yeah, it's great that, yeah, they were able to contribute and provide, yeah, the information to the next generation.
Yeah, I think that was a good idea to include them. Like you said, old habits die hard. So it was good that they were there to give their their views. And this is something actually would be very important for us in the medical field. This this process that you have developed, and the web page and the media that you have developed, because we in the medical field are always coming across not only with for our patients but also staff who are shift workers, and this is something that I think we should spread the word on this. The other question I had, what were the main barriers you felt you had while creating this project or implementing the project, and what take-home points we can take if we were to design something like this?
Yeah, I think that's a really good question. I think the main barriers were, well, the main challenge, I think, that the scientists here can really appreciate is really trying to get a clear message across to people without getting which is scientifically accurate but clear. And so, I'm sure everyone can imagine there was a lot of robust discussion around certain things, and no, I don't think it should be worded this way because this paper says this, and So I think that was the most challenging bit, was trying to get everyone's voices together to not just say, okay, we need more evidence for this, we need more evidence for this, which we do in some places, but I think it's really important to be actually be able to tell people something. And yes, the evidence might change in certain areas where but that's what science is. We are providing our best advice based on what we've got now. And things develop and change over time. And so we're continuing to work with industry and workplaces and trying to get bits of funding to really make sure that this platform is something that is a live platform and does continue to develop as the evidence develops. So I think that was probably the most challenging thing. In terms of learnings, I think, bringing shift workers or bringing participants or people that you're working with into the process early was super valuable, and just hearing their perspectives and voices, I think really made this project, rather than going in and saying, okay, here's something that we've already made, what do you think about it? Actually, the step before that, okay, what do you want or what do you think it should look like? And having, that is a very equal process, rather than scientists coming in and saying, oh, we should do it this way. So I think that's the main learning for me.
That's excellent. So we have a question. I'm going to read it out. Will there be continued research to see how much the health was improved by individuals who started their healthy shift work at the start or mid-career? See the long-term effects. Is there any research about individuals who are on call and have to flip shift or sleep, or even doctors that do 24-hour shifts?
Yeah, fantastic question. So the first one, in terms of tracking shift workers across time. So as part of this project, I didn't present that today, but we did a really small evaluation of the project. Really small, it was around 20 shift workers. We got them to view the resources and then track them across a not very long time, couple of months. And we did see some improvements in their sleep, but it was all self-reported. So it was a very small pilot evaluation. We'd love to do a bigger one. And also, we've got lots of great information on the website, but my hope is that we can really move it into sort of it's called an e-learning package here. I'm not sure what that's called in America, but more of an educational platform where you can go through things in just a not here's a bunch of text kind of way, but here is how it's kind of being taught to you. And so that's what I'm hoping is the next step, and that we can evaluate that process as well. That's definitely a goal of ours. And as I mentioned as well, moving into the digital coach space and using a lot of this content that we've created through this project to move into a digital coach, and actually assessing how that can improve shift workers and measuring a range of health outcomes. That would be great. It's always a funding thing, as I'm sure it is everywhere. In terms of on call, that is a real on call work. That is a real focus of our research group, and we are in the process of developing some resources specifically for people that do on call work. So we should have those out sometime next year. So really focused on that on call aspect. I think that's particularly important because you have people, trying to sleep. I mean, even this morning, getting up early for this talk, I probably woke up 4 or 5 times at night thinking, oh, okay, I hope I haven't slept through my talk. So you're kind of sleeping with one ear open all the time. And so, but you might not be working, but your health and your sleep is still disrupted. So we've done a lot of research in that space, and that is a real missing piece. And so we're actively working in that space as well. 24-hour shifts for doctors, our emergency services teams here, a lot of them work on 24-hour shifts as well, and that obviously has unique challenges too. So that would be a space that we're wanting to look at as well.
Thank you so much. Another question. Will that be part of the Healthy Shift Work page as this turns into an e-coach? Will it turn into an app? That was my question too. Will you have an app?
Yes, that's the goal. To have a AI agent that is essentially a coach that is based on, that's pulling data or pulling content from what we've created to provide advice. And our goal at this stage is to include wearable data within that process, so that the advice is based on the data that's going in from the person. So yeah, and the hope is that will be available through the website, and my whole mission is for this to be all accessible and freely available to people rather than a commercial product. So yeah, watch the space.
Yeah, we'll be excited to have the app. Oh. So are you tracking your website to see how many hits you're getting, and is it locally in Australia, or are you getting hits from all across the world? Now that we have this webinar, maybe you'll have more hits.
Yes, no, we are. We've got a wonderful person who did all the website and the infographics, and also is involved in the analytics as well. So yeah, getting hits from all around the world, all sorts of different places. So it's
That's
yeah,
nice.
always great to see those updates. And yeah, we've had a lot of interest, particularly locally, from certain groups, our police force, our firefighters, as well as a couple of big state-based, our government. So we recently got 2 small government grants to further tailor these resources and create more infographics as well. So yeah, there's been a lot of interest, as well as us going and doing training at organizations too. So it's been a great platform for future work. And yeah, it's just been, that's great. And as a researcher that needs to continue to bring in funding, it's been great. But I think probably more importantly, it's just been great to get the feedback from those shift workers themselves. And this has really helped me, or I didn't know how long caffeine stayed in my system, and I didn't know the impacts of alcohol on my sleep, and all of those things are really what gets me up in the morning.
Other than this webinar.
Other than this webinar, yes, yeah, correct.
Okay, I don't see any other questions. Did you want to add anything, closing remarks, Dr. Vincent?
No, that's great. Thank you very much for having me, and yeah, check out the website.
Well, thank you so much. This was an excellent talk, and we learned a lot, and I'm very excited that we're going to be using this, I'm sure, for the ones who know about the site, and there'll be more interest in this kind of research. So thank you, Dr. Vincent. Thanks to everyone who participated today. For today's webinar, there will be an email sent out with instructions on how you get your CME credits. As I mentioned earlier, the webinar is approved for 0.75 AMA credits. In addition, I wanted to mention that the ASM Foundation has webinars taking place this year, other webinars. We invite you to register for our mid and senior career research program opportunities webinar in July. To learn more about these grant programs, registration will open soon. Additionally, the ASM Foundation is accepting applications for our early career research programs and community programs. Please revisit foundation.asm.org for more details. And as you see here, the infographics on this. So thank you all again. Thanks for joining us, and have a good rest of the week.